my name's Jayla. I'm the occupational therapy student that's going to be working with you today. How are you doing?
Good.
Good. Can you go ahead and confirm your first and last name and date of birth for me?
Damon Dinkle, July 5th, 1979.
Okay, awesome. So I understand you've had occupational therapy before, is that correct?
Yes.
Okay, so kind of walk me through what a typical day looks like for you.
I wake up, I stay home with my kids, so I have to cook their breakfast in the morning. I have a difficult time taking a shower.
Okay.
I have had a few falls, but I'm okay.
Okay, awesome. So we're going to kind of be looking at all of that stuff today, just seeing how you're doing with some of your day-to-day tasks, the areas that you're needing more help with, or the areas that you're excelling in and don't need us to address. So we'll kind of address those through a few assessments that we're going to do. I'll talk to you more about those and we'll kind of get into the nitty-gritty of them at the time. But I'm first going to start with your vitals. And then at the end, we'll look at a home exercise program with just some tips and tricks and some modifications that you can make for your activity tolerance and endurance, and just keeping some of your strength and mobility up, okay?
Okay.
Okay, we're gonna go ahead and start taking your vitals. I'm gonna start with your blood pressure first. I'm gonna get everything cleaned off so that way it's ready to go for us. Okay. Are you experiencing any pain today? No? Okay. Got all throughout the session. You do just let me know and we'll address it at that time, okay?
Okay.
Go ahead and clean all of these just so that they're ready for us. Okay. We're gonna go ahead and do blood pressure on your right arm, just because I know you're experiencing some spasticity in that left arm, okay?
Okay.
Do you know typically about what your blood pressure runs?
Now I think about normal.
About normal? Okay. Okay, yeah, keep those feet flat on the floor for me. Good, I got 100/78, which is good. That's something to be concerned about. Okay, now I'm gonna go ahead and take your respirations and your heart rate, so I just want you to relax, okay? Okay. Respirations were 18, which is normal. The normal for adults is 12 to 20. And then heart rate was in normal range as well. Okay, now we're gonna go ahead and take your pulse ox. Perfect. Just keep that hand rested there and just relax. Perfect. Oxygen level is 99. Okay, now we will move on to our other assessments. Okay, so now we're going to move on into those assessments that we kind of talked about, and the purpose of these is just to kind of keep me and you on the same page to where the things throughout your day you're having a difficult time with, or the things that you're doing well with and can do those independently and that we don't need to address, okay? So I understand that some of your responsibilities are making breakfast for your kids, getting to the bathroom, things like that. So this first one we're gonna do is called the Barthel Index, and this is one of the gold standards of the assessments that occupational therapy does. So it's gonna look at a few things like feeding, bathing, toileting, those kinds of things, and to see what parts you're needing help with, not needing help with, and then we'll kind of go from there, okay? Okay, so first thing with feeding, tell me what that kind of looks like for you. Are you needing any help with that? Are you doing it all independently?
I can do most of it with my right hand.
Okay, what about as far as like cutting or using the stove? Are you able to use the stove or do you need help with that?
I don't use the stove.
Okay, so mainly just kind of meal prep types of things.
Yeah, I can cut.
Okay, perfect. What about as far as bringing food to your mouth yourself, as far as feeding goes?
Yeah, I can do that with my right hand.
You're right. Okay, awesome. Okay, and then moving on to bathing, I know you said that you're typically needing help with the shower.
Yeah.
Are you doing any of it independently, or is it just with the transfer? What does that kind of look like?
I need help with the transfers, and then once I'm in there sitting, I can kind of wash.
Okay. Okay. And then what about grooming? So grooming includes, shaving, brushing teeth, putting on deodorant, washing your face, those kinds of things.
I can do it, I just sometimes don't do it.
Okay. Are you standing at the sink to do it? Are you sitting in your wheelchair? Where are you kind of doing that at? Sitting. Okay. Okay. And then what about dressing? As far as upper body dressing goes, is putting shirt on, taking shirt off, or a jacket even?
It's hard.
Okay. How are you doing with fasteners as far as like buttons and zippers?
Not good.
Not good. Do you need some help with that typically?
Yes.
Okay. And then what about taking pants on and off, socks and shoes on and off? Are you doing that independently or needing some help?
I need help.
Need help with it with all of those?
Yes.
Okay. Got it. Okay, and then how about bladder? How has that been? Are you having any accidents or experiencing any incontinence where like urgency where you need to go right now and not able to make it?
Not urgency, but I have had a couple accidents, but it's not a big deal.
Okay, so not something that you're concerned about?
No.
Okay. Okay, and then once you are getting into the bathroom, what does that look like for you? How are you transferring up and down from the toilet? Once you're seated, are you able to kind of do your hygiene from there? Are you needing any help, any assistance?
I can transfer to the toilet once I'm there. They keep telling me I need grab bars, but I don't want those in my bathroom.
Okay. Once you're seated, are you able to do like your wiping and every kind of hygiene in that area on your own?
Yeah.
Yeah? Okay. Okay, and then how are you doing transferring in and out of bed? Are you needing any assistance with that? Are you doing it solely independently? What does that kind of look like for you?
I need help sometimes just because after sleeping in the morning, my body hurts.
Okay. Are you getting up straight from your walker? Are you going to a chair or your wheelchair at that time?
My walker.
straight to your walker after that. Okay. What about getting back into bed? So at the end of the day, going from your walker to your bed. Are you needing any help or doing that independently?
I just plop down.
Just pop down. Okay, got it. Okay, so I understand that you have one step in your home, is that correct?
Yes.
Okay, so how are you doing as far as other mobility? Are you getting outside of the house at all?
Yeah.
Yeah, okay.
I fall.
You're having a lot of falls?
Yeah.
Okay. When you are leaving the home, are you using your walker or your wheelchair?
Both.
Both. Okay. And in the home, which one are you primarily using?
Walker.
Your walker. Okay. Do you need any assistance or somebody close by you, somebody touching you, or are you just navigating by yourself throughout the house?
I'm just navigating.
Okay, gotcha. Okay, and then last one, we kind of talked about that one step that you're having. Do you need any help getting up and down from that step, or are you doing it solely independently without any modifications?
I'm doing it.
You're doing it? Okay. What about if you were to go to a doctor's appointment or anything like that, have you tried to navigate a flight of stairs?
No.
No? Okay. All right. Okay, I'm going to go ahead and score this, and then I'll get back with you and we'll kind of talk about your results and what they mean and go from there. Okay, so now that we have scored that Barthel assessment that you just completed, we're going to kind of talk about your results and what they mean. So this was the one that you completed in regards to some of your daily tasks, such as dressing, grooming, feeding, bathing, and whether or not you're needing assistance with them, or if you're doing some of these tasks independently. Okay, so based on some of your scores, so your score was 75 out of 100, which falls within the 61 to 90 score range when scoring this assessment. So you being within that range classifies you as moderate dependency. And so what that really means is that throughout your day-to-day life, from start to finish, when you wake up in the morning to when you go to bed at night, that you're needing about a moderate assistance with some of these tasks. So you're not able to do them fully independently. Maybe some you are, some you're not, but that there is some things that we can work on too. That's kind of what this tells us. It tells us what areas need to be addressed, what things we can work on, and then where we can gain you some more of that independence and really hone in on some of those skills that we can maximize on, okay? So moving forward, we'll take this information into our sessions, and this is going to help keep us on the same page and knowing what tasks are important to you and where you're needing the most assistance with, okay? Do you have any questions for me?
Nope.
Okay.
I think so.
Okay, now we're going to be moving on to the fatigue severity scale, which is often referred to as the FSS. And the purpose of this assessment is to determine the impact that fatigue is having on your daily responsibilities, your duties, your activities that you're engaging in, and just your physical function overall from day to day. So Shirley Ryan Ability Lab is a rehabilitative center that conducts a lot of research, and they found that the FSS was a great assessment and reliable towards patients with MS. So this is going to be a good scale for us, again, to determine that fatigue you're having from day to day. Okay, so this is going to be a 9 item assessment, and it is scored on a Likert scale from 1 to 7. So 1 being you disagree, all the way up to 7 is where you agree. Okay, and you're just going to circle either 1, 2, 3, 4, 5, 6, or 7 as we go, based on your perception of that question. Okay. If you have any difficulty with circling, please let me know. We can modify it as we go. Do you have any questions?
I don't think so.
Okay. All right. And I will also read the item to you so we can make this a little bit smoother for you. Okay?
Okay.
Okay. So this first one here is my motivation is lower when I am fatigued. Disagree or agree? Good. Number 2, exercise brings on my fatigue. Number 3, I am easily fatigued. Okay. Number 4, fatigue interferes with my physical function. Number 5, fatigue causes frequent problems for me. Number 6, my fatigue prevents sustained physical function. Number 7, fatigue interferes with carrying out certain activities and responsibilities. Number 8, fatigue is among my 3 most disabling symptoms. Perfect. And then number 9, last one, my fatigue interferes with my work, family, and social life. Okay, wonderful. I'm going to go ahead and score this, and then we will talk about your results once I'm back. So now that we've done some of those assessments, we're going to go ahead and discuss the results of those and just how they're impacting your daily life, and then how we can move forward based on these results, what we need to do as far as your plan of care, intervention, those kinds of things, okay? So the fatigue severity scale, this is the 9-question one that you did where you agreed or disagreed based on how fatigue was affecting you. And your total score was a 47. And based on the assessment itself, any score that is over 36 suggests that you are being greatly impacted by fatigue, which I would assume this is information that you are already aware of because it is your day-to-day life and you're the one experiencing it. But this just gives us a good idea of how significant that is. So moving forward, we know the importance of looking at energy conservation strategies, working on endurance, activity tolerance to hopefully counteract some of this fatigue and give you some more function throughout your day-to-day life to where this is not impacting you as much. Okay. Do you have any questions about this?
Nope.
No? Okay. Alrighty, so now we're going to be doing the timed up and go assessment. The purpose of this assessment is just to see how you're navigating throughout your environment while looking at your balance, how you're walking. And I know you're using your walker in your home, so we just want to kind of see what that baseline is of how you are walking throughout your home and see if there's possibly any fall risk. I know you're experiencing some falls, so this will kind of give us a good idea of that, okay?
Okay.
The reason I chose this assessment is the MS task force. They completed a wonderful research study that I can provide you with that they took a bunch of assessments and kind of picked the ones that are going to be best for addressing patients with MS. So that's the reason that we're doing this one. It should be a good tool for us to use, okay?
Okay.
All right, I'm going to go ahead and read the instructions to you, and then we'll go ahead and get started, okay? When I say go, I want you to stand up from your chair, walk on the line on the floor at your normal pace, turn, walk back to the chair at your normal pace, and then sit down again. Okay, so we're just going to go to that tape line that's down there at the end, okay? Do you have any questions for me?
No.
Okay, go. Now we're going to be talking about the results of the assessment that we just did, so the timed up and go. So it's recommended, based off the scoring of this, that anything over 12 seconds to complete that sequence is going to be at a fall risk. And so it took you 1 minute and 21 seconds to complete, which is okay. That just gives us kind of an understanding of where those deficits might be, and it also gives us an idea of what things we can work on. So as I watched you walk, there's some things that we can work on as far as positioning, how your stepping is going forward and backward, and as same as your turning. So just gives us an idea of things to work on, and then also your safety as well. Do you have any questions about this or about the assessment or the results?
No.
No? Now we're going to be kind of moving into some of those strategies that we talked about based on some of those deficits that you're having, based on the assessments that we did. So some areas that we can, incorporate some little tips and tricks that are going to, help that fatigue that you're having and just conserve some of your energy throughout your day, okay? So I want to briefly talk to you about MET levels. So MET levels are how much oxygen your body is requiring during an activity. So for example, you sitting here as you are now is going to be a really low MET level, possibly like a 1, versus if you were folding your laundry or, standing doing the dishes, something like that, it's going to be a little bit of a higher MET level. So it's just how much oxygen you're putting out during an activity, okay? And so with your condition of MS, it is recommended by the American Journal of Physical Medicine and Rehabilitation that your MET levels stay within that 1 to 5 range. So any activities that you're doing that stay within there are going to be good, and they're going to be indicated and safe for you to complete. Whereas, we start to get above 5, we start to get in some pretty rigorous and strenuous activities where our MET levels jump up a lot, and that is going to cause you a lot of fatigue and possibly experiencing some fatigue for a few days or an extended period of time. We don't want that. We want you to kind of keep at a good balance to where you can still engage in your responsibilities and activities that you have at home. Okay. A few other examples that I can give to you. So when you're taking your shower, I know we kind of talked about that. When you're taking your shower, sitting down, you're going to be at a MET level of 1 to about 2.5. And so that's going to be safe. That is within your range of your daily activities. And that goes the same as far as dressing, grooming, and even the light meal prep that you're doing for your kids. If you were to stand to be doing that, your MET level is going to jump up. But if you were to sit as you already are when you are, preparing the vegetables and cutting and things like that, that is going to be within your MET level range. So that's going to be good there. So just making those accommodations versus standing versus sitting. Okay. Okay, so I have this handout for you here that's going to talk about some of those energy conservation strategies that you can use throughout your day. So these ones are just kind of general, and then we'll talk about some ones that are more geared to your self-care, okay? And I made some notes and highlighted some things on here. All of these are good to look at and important, but these ones are just kind of stuck out to me that I think are going to apply to you the most, okay? So the main thing that's really going to help with that fatigue that you're having is just pacing yourself throughout your tasks. So making sure that you're not in a rush, because we know, again, once you get into a rush is when we start to experience falls and things like that. Our balance starts to kind of go at that time as well. So just pace yourself throughout your activities. Schedule kind of your activities out so that way you're not in a rush, and allowing yourself enough time to complete, dressing, meal prep, those kinds of things. Okay. So kind of going into that, so make sure you're planning ahead, that you're gathering all your items. So when you're preparing breakfast for the kids, kind of getting everything to one spot in the counter first, so that way you can stay there and complete it from there versus having to go, grab the flour, grab the eggs, all at different times. So kind of planning ahead, gathering all your things at once, that's going to save you a lot of energy. Again, kind of going into just prioritizing your tasks as well, which it sounds like you're doing a great job doing already. You're engaging in those things that you want to and that are important to you. But then I know that you mentioned that you're taking some naps throughout the day as well, which is totally fine. Again, that kind of goes into our next one. It's just resting as you need to. Don't push until you're completely exhausted, because then we start to, have things like falls, or you're having fatigue for multiple days on end. So doing your activities, but prioritizing the ones that are important, and then resting as you need to. So taking a rest every hour or so is going to be really helpful. Okay, so those ones are just kind of general, day to day. And then some specific ones that we can do for self-care. So there's ones that go into eating, grooming, bathing, and then dressing. So with eating, it sounds like you're already doing a very good job of getting like a nutritious meal, but keeping up those nutrients. But when you are completing your eating process, making sure that you're having a slow, meal that you're not rushing, just giving your body enough time and to digest your food versus you're in a rush and then your body's having to work really hard, which I know might sound silly, but when we eat quickly, our body works really hard and puts a lot of energy into digesting our food. So just giving it enough time, taking it slow, that kind of thing. Grooming. Grooming is one of those things that you're probably doing standing at the sink. Is that correct?
Yes.
Okay. So that is great. But something to kind of consider too is if you're having a day where you are having a great amount of fatigue, or say you had a lot of big tasks that you were doing that day, it would be beneficial for you to maybe pull up a chair or a bench or something to complete, your teeth brushing, washing your face, all of those kinds of activities that you're already doing standing. It's also going to give you some more support and be able to do that for a longer period of time because you're not having to do so much energy sitting as you are standing. That kind of goes into the bathing and grooming. I know we've talked about a shower chair. That's going to be really helpful for you. It's going to save a lot of your energy and increase your safety, as well as keep you within that MET level range that we kind of talked about previously. One note that I did want to make with your shower, I know hot showers feel super, super nice, but interestingly enough, when you're taking a hot shower, the steam that is happening in there actually increases the amount of MET level that activity is giving to you. So with a hot shower, you're going to look at a MET level that's around 4 to 6, whereas a cold shower, not cold shower, but like a warm to cool shower where there's not so much steam, that's going to keep you in that safe MET level range of 1 to 3, okay? So that's just something to keep in mind. Those hot showers are going to take a lot more of your energy versus just a warm, cool shower. So I just wanted to make note of that there. And then dressing, it sounds like you're already implementing some of these strategies. I know you're already sitting to dress, so keep up with that. Sit where you can. That's going to give you some more energy to spread out throughout your day. So you keep up with that. Again, allowing yourself enough time, grabbing your shirt, pants, socks, shoes, jacket all together, then completing dressing versus one item, going to grab another one, another pants, going to grab another one. So keep all those items close to you and then go from there, okay? So I'm just gonna hand this to you. These are just some things that you can kind of look at, refer back to, and then implement those ones that work for you. And if some of these don't work for you, that's okay. Don't worry about them. But find the ones that do work for you and save some of that energy so we can keep you kind of engaged in your functional tasks and not be so fatigued, okay?
Okay.
Do you have any questions for me about these?
I do not.
Okay. We're going to be moving into some of those exercises that you can incorporate in your daily routine just to keep your activity tolerance and your endurance up. So the National Multiple Sclerosis Society, they're a wonderful organization. They completed a lot of research in how to best live and some tips and tricks and skills that you can work on as an individual that is living with MS. So they recommend that aerobic exercises and pulmonary exercises are very good for increasing endurance, increasing activity tolerance, and then in turn, decreasing some of that fatigue that you're experiencing from day to day, okay? So we're gonna do 2 sets of 10 of these. It is recommended that you do this in a chair with arms when you're at home, just for safety purposes. But today, we're just gonna do it, and then I have this gait belt on you in case we needed it. But when you're doing these at home, I would recommend that you do it in a chair with arms, okay? Okay, so we're gonna do 2 sets of 10 of these. We kind of got that, or I got that number from your MET level. So we're doing this seated to decrease that MET level. And then we're also doing just 4 of these with 2 sets, or 4 exercises of 2 sets, okay? So this first one here, so I want you to make sure those feet are flat on the floor. Good, okay? So as you breathe in, you're gonna breathe in through your nose and arms come up. And then you're gonna breathe out through your mouth as arms come down. Okay, go ahead and do that one for me. Very good. We're gonna do 10 of these. Good. These are all gonna help with that range of motion that you're demonstrating a little bit of difficulty with as well. Kind of loosen up those joints and stretch you out just a little bit as well. Good. Okay. This next one is arm curls. So elbows are going to be tucked in as you bring hands to your shoulders, you're going to breathe in through your nose and then out through your mouth as you lower them to your lap. Good, we're going to do 10 of these ones as well. Good, okay. This next one is going to be a side twist. So the important thing with this one is keeping those feet flat on the floor. I really want you to try to keep that good upright posture and engage your core with those shoulders back, okay? Okay, so as you breathe in, arms are going to come across your body. And then as you breathe out, you're going to kind of blow them all the way across. Same thing. And then blow them across. Good, yeah, and keep that good trunk rotation. We're going to do 10 of these as well. Good. Okay, this next one is a side bend. This one, if you're doing this independently at home, definitely have a chair with arms with this one, but I will just kind of assist you with it today, okay? So you're gonna breathe in as you come over, so in and out, coming back up. In, out, coming back up. So we'll do 10 on each side, okay? Actually, let's do 5 on one side and then 5 on the other, okay? Go ahead for me. Good. Good, let's do the other side. Good, last one. Good. And when you're doing these at home, and you have that arm or that chair with arms, you can always kind of hold on to there or even put some weight into that elbow as you bend over. That would be a good thing to work on as well. Okay. Do you have any questions about these? I will give this handout to you to take home.
Nope, I don't think so.
Okay. Okay, so the last kind of exercise program that I'm going to send home with you is some towel glides. So the purpose of this is just to get that left arm. I know that after it gets used, it kind of does that curl up, which we call flexor synergy on you. So this is going to help kind of get those muscles, joints loosened up, get you some mobility, and just kind of give you some release from that spasticity as well. So these will be really good to do after some of your activities to help get you kind of back into that extension. So after you've done some light meal prep in the kitchen, these would be great to just do sitting at the kitchen counter as you already are. Just grab you a towel really quick and then do these, okay?
Okay.
So these are going to stay within those MET levels that we talked about because you're seated and you're not exerting too much. So these are kind of still in that light range, okay?
Okay.
And we can talk about how we can modify these to make them more difficult and get you some more strength as we go. But for right now, we're just going to do them without any weights or anything like that, okay?
Okay.
Okay, so this first one here, so you're going to do flat hand. Let's use that left hand. Yep, flat hands right on there. Okay, so you're going to put a little bit of pressure in there to kind of give you some proprioception or give you some input to that hand. And I want you to slide forward as far as you can go, and then you're just going to slide, bringing back to you. So I just want you to feel a pretty good stretch. Make sure that elbow can kind of get extended out in that shoulder. Good. Now I just want you to go as far as you can, and then you're just going to bring it back. Good. Does that feel okay?
Yep.
Let's go ahead and do one more just like that. So I'm going to have you do 2 sets of 5 of these. So you're going to do 5 times each, and then you're going to go through them once. And if you need to break up your sets, maybe do one in the morning, one in the afternoon. That's totally fine too, okay?
Okay.
Okay, so similar thing. Next one, you're going to do flat hand on there. Let's go ahead and get that arm kind of extended out. Good. Okay, then this time, I just want you to take it to your left, kind of like you're wiping the counter or reaching for something, and then you're going to slide all the way across your right side of your body. Yeah, so this one's really good for reaching. wiping down the counter as you need to, dressing as well, just getting that elbow, shoulder, everything kind of loosened up in a good position for you. Very good. Did that one feel okay?
Yep.
Okay, awesome. This time, I want you to bring it a little bit closer into you and kind of rest that elbow on the table. Good. Okay, so similar thing, except it's going to be a little bit of a smaller motion this time. So you're going to slide left and then slide right. Good, yeah, try to keep that elbow planted. Good, these are just working on some more controlled movement. Good. Okay, and then last one here, so flat hand again. And this is going to be kind of like a V motion. So I want you to kind of go on a diagonal up to your left, back to the bottom of your V, and then up to your right in that diagonal motion again, okay? And stretch that arm out as much as you can, or that's comfortable. Very good, and then back to the base of your V. Very good. Very good. Okay, so you can do these with both sides. If you're having a day that just the spasticity has kicked in so much, you're having some pain and just feeling stiff, it is great to do these in both sides. I know that you're having more of that spasticity in the left, and it's kind of the one that curls up on you, but it is good to do on both sides just to keep you loose, okay?
Okay.
Do you have any questions for me about this?
No?
No? Okay. So yes, I'm going to send this home with you for you to do throughout the week and incorporate with some of those other exercises that we talked about. But if at any time these are becoming painful or you're feeling dizzy or lightheaded or anything like that, I want you to go ahead and stop, take a break, and then maybe resume them the next day. All right. So I know we covered a lot today. It was kind of a loaded session. Do you have any questions for me at this time? Concerns moving forward? Anything that I gave you today that you're concerned about?
I don't think so. I'm ready for therapy.
Okay, well you keep plugging along and we're just gonna be here to collaborate with one another, make sure that we can get you back to be as independent as possible as well as safe. Just as a reminder, any of those exercises and tools that I gave you today, if things aren't working out, let me know. We can modify, adapt as we go. And I just want to make sure that you're safe doing those. So dizziness, headache, anything like that, go ahead and stop. And again, bring it to me. We'll connect, we'll talk about it, and then we'll move forward from there, okay?
Sounds good.
Alrighty, we'll see you next week.